Welcome to the Sencast. My name is Dale Pickles, Managing Director of B Squared and the host of the Sencast, a podcast for special educational needs and disability. And every week we talk about a different topic within the world of SEND to improve our knowledge, to provide support to professionals working in schools, to empower parents and to raise awareness. In this episode we discuss PANS and PANDAS, and if you don't know what they are, keep listening. And I was joined this week by Tina Coope, the education lead from PANS PANDAS UK. Tina is a former teacher with a master's in education. Driven by lived experience, Tina became the education lead for PANS PANDAS UK. The Sencast is created by us here at B Squared. And do you know about our AI features within our assessment software? Teachers can use our AI to help write their reports or summarise progress. Teachers choose the key achievements from the system for their or key next steps. So it is very personalised. But the AI takes that hard work away, turning on those key things you want to focus on into a lovely paragraph of text. And the system can also translate that text into 40 different languages, helping to engage parents. So visit the B Square website or click on the meeting link in the show notes to book a meeting with me to take you through our assessment software and its AI features. But now, come on, let's get on with that podcast. My guest on this week's episode is Tina Coope, the education lead from PANS PANDAS UK. Tina is a former teacher with a master's in education, and she led a specialist autism provision and founded a nurture unit in an infant school. When her daughter suddenly developed severe neuropsychiatric symptoms at age 7, Tina's professional and personal worlds collided. And driven by that lived experience, Tina became the education lead for PANS PANDAS UK. Welcome to the show, Tina.
Oh, thank you so much for having me. I'm really excited to be on the podcast and share more about it.
You are very, very welcome. The first time I heard about PANS and PANDAS was someone from your organisation coming up to us at the TS show, and I wasn't at the stand, but someone told me about it all and they were really excited. And I remember reading the leaflet going, ooh. And since then, I've heard it mentioned a few times on social media and in other places, but my very simplistic understanding is that PANS and PANDAS aren't present at birth, but a response to an infection, and they have a huge impact on that person and may present like a neurodivergent condition. Now, as with everything, we may have a snippet of information about something. It might be wrong, it might be right. But it is always great to have an opportunity to get the real answer. So, what are PANS and PANDAS? What they actually are? What are they?
So that's a really good question. And you're certainly not alone in not fully understanding what the conditions are. In essence, they are medical conditions. So they're long acronyms. So PANS stands for Paediatric Acute-onset Neuropsychiatric Syndrome. And PANDAS stands for Paediatric Autoimmune Neuropsychiatric Disorders Associated with Streptococcal Infections. So quite a long mouthful. And both are proposed post-infectious and neuroinflammatory condition. So in essence, a child or young person gets an infection, they get better, and then there's this proposed neuroinflammatory response that affects their brain. And then seemingly, often out of nowhere, the child or young person will develop a whole sign and spectrum of neuropsychiatric symptoms. And some of those could be obsessive compulsive thoughts, tics might be present, restricted eating, and a whole host of other signs and symptoms. And you, Dale, have got the look on your face that we often see when we're chatting to people about these conditions, because it sounds a really difficult concept to take on board.
So, my again, so simplistic. You'll be going, oh. So in my head, it's like you maybe have something like chicken pox. And basically, I'm going to say your entire child's personality is now completely different. That's really simplifying it to a personality. But it kind of, you said that OCD, the eating habits, the way they respond to something, that almost like there are things which are going, okay, they weren't there before. And that's not just them being ill for the first time and feeling maybe unsafe and a bit dysregulated. Actually, you're probably noticing a big change.
It definitely is a big change, and it's interesting because you use the example of chickenpox.
Yes.
So pandas is always triggered by a strep infection. So that could be scarlet fever, strep throat, tonsillitis, for example. Whereas PANS has a much wider set of potential triggers. So, for example, could be COVID-19, could be flu, could be the chickenpox in your example. And the P in PANS stands for Paediatric, obviously meaning children, but it's really misleading because PANS can actually affect anyone at any age. But when you kind of talk about a change, you're right. It usually represents a significant change across a child or young person's different areas of functioning. And you can get a really wide range of symptoms such as anxiety, very severe separation anxiety. You can also get some cognitive and learning changes. Handwriting can change, maths ability can change, and that can go alongside these obsessive compulsive thoughts, potential tics, potentially restricted eating. So, a real wide range and scope of potential symptoms.
I just want to be clear, probably straight from the beginning, that someone listening to that might go, oh, that's kind of worrying about death, worrying about being ill, wanting to have mum and dad near all the time. This isn't just that. This is medically recognised. Just want to throw that in. If someone's going, oh, it just sounds like they just need. This is a fully recognised medical condition, isn't it?
Yes, absolutely. So PANDAS is recognised by the World Health Organization. Both conditions are recognised as discrete disease entities by the NHS. There's lots of work going on in the background to create a UK clinical guideline. Local authority guidance is also in the process of currently being created. So these are distinct and recognised medical conditions. And what we find is because they cover such a broad range of potential signs and symptoms, and because levels of awareness are really low, often this isn't being picked up as potentially PANS or PANDAS within a kind of a school or educational setting.
So let's go back another thing. Not how long has PANS or PANDAS been around? Because the answer is we probably can't really say. It could have been misdiagnosed and things like that. But how long has it kind of been recognised?
That's a good question. So, PANDAS was identified back in 1998, so a little while ago. PANS a bit more recently, I think around 2012. And in terms of recognition by the NHS, that's been more recent. So that's been in the last couple of years. So we had a parliamentary debate where Maria Caulfield, who was in office then, kind of declared that PANS and PANDAS were recognised as discrete disease entities. And then more recently, the NHS actually have just issued an updated statement about the complexities around their conditions, that they're recognised and that this is an evolving picture. And I think that's important to take on board. Our understanding of these conditions continues to evolve.
So my next question was going to be, and the probably answer is we're still learning, is I'm going to say, and again, I've got air quoting, a perfectly healthy child
Yeah,
can get chickenpox
yeah.
and can now have PANS or PANDAS. There's no lifestyle thing. There's no, as far as we know at the moment, there's no indicators. It's just what happens.
We're still learning. There's a lot we don't know. I think clinicians are exploring the possibility of genetic links and environmental factors. And from a non-clinical perspective, I think they're looking at there's probably a whole range of potential kind of risk factors or factors that may involve. But we don't really know. We don't know because we know that all children get infections and all children get strep at some point, and that we don't know why some children go on to develop this response to those infections.
Cool. So earlier I mentioned it can present like a neurodivergent condition. I think someone said to me it's like they're definitely not autistic, but now they are autistic. And I guess that's the presentation, but there's a wide range of impacts, as you said.
It's a really complex, and I feel like I'm saying this to all the questions. It's a complex and evolving area, but it genuinely is. So What we know is that some of the symptoms, so the medical symptoms of PANS and PANDAS, can overlap with neurodivergent traits. So we know that that happens. We also know that some neurodivergent children and young people can additionally develop a medical condition like any other group of young people and children, and they can also develop PANS and PANDAS. So it's a whole area of complexity, which really highlights our need to have thorough training in the area so that our neurodivergent children and young people receive equal access to medical evaluation if required. Does that make sense? I
Yeah.
realise that's all quite complicated and woolly.
But it's like when I was a governor, I did prevent training.
Yeah.
And it is one of those things. There is no simple list of this is what it looks like. What you're really doing is it's a change. With the
Yeah.
prevent, you're looking for someone who was quiet who now isn't, someone who was loud but now quiet. I think it sounds like with PANS and PANDAS is after an illness, and again PANDAS is very specific, chickenpox, strep, that sort of stuff.
Yeah.
PANS is much wider,
Yeah.
but it is that change after that illness that is more than just maybe being at home for a couple of weeks and not wanting to come back to school and getting over that. It's more than that.
It's much more significant than that, and that's what's really difficult to get to get across. And obviously the families who witness because we always talk about children and young people having multiple unexplained changes. So one of the potential hallmarks can be changes across different areas of functioning, so like self-help skills, writing. You can have changes in your working memory. Obviously you can have this sudden onset of these kind of obsessive thoughts that we thought of. You can have difficulties organizing yourselves, and it's really difficult to convey the level and extent and potential scope of those changes if you haven't been part of that child or young person's journey. And that's what's really difficult. So we've got professionals with all sorts of different kind of perspectives and take on it. And one professional said to me that professionals have the privilege of not believing it until they've actually witnessed or been present in a child to whom they've seen it happen to.
That's the thing. It is because again, things you mentioned is like we generally relate it to. Oh, it's like an obsess. So generally, immediately you're putting it in boxes, but it's not that simple. It's not a case of so if they'll get an autism diagnosis. Well, they may not. Certain things may present like autism, but may not meet the threshold for a diagnosis. But at the same time, they might have this, and that same height. That's, as you said, that short-term memory. It could be affecting so many different ways that they'll actually maybe struggle to get a diagnosis of one of those, and they kind of could be being stuck in this middle zone of can't get a diagnosis, therefore can't really get any funding or support without a diagnosis. And I bet there's probably lots of families who end up in that circle of not sure what's going on, trying to get help and struggling to identify what's going on.
Certainly it's difficult because you can't know it's PANS and PANDAS if you don't know that the conditions exist.
Yep.
What the potential symptoms there are, and we've kind of alluded to those. And I think it's important to say there is a clear diagnostic criteria.
Ooh.
And so it's not just a random collection of symptoms. They have to fulfill this particular criteria. But in terms of the framework around families, in terms of that level of often confusion about what is happening here, then absolutely, and that's often for families and it's for professionals, and it's very easy for those symptoms to be misinterpreted as something else, and for the whole picture not to be gathered. Because there's such a scope and range of symptoms, you might not ever realise that they could all be linked to one potential condition. We wouldn't normally link perhaps handwriting changes with obsessive compulsive thoughts, just as an example. And we often find it's the loudest symptoms, which sometimes they're quite psychiatric in nature, those are the ones that are focused on, and some of those perhaps more in the background symptoms, such as changes in working memory, executive functioning, decline in math skills, for example, tend to kind of get pushed in the corner. But actually giving equal weighting and scope to all of those symptoms gives that proper representative picture of the changes that have happened. And then it's about asking, well, could it be? Is it possible that it could be PANS or PANDAS?
And I can imagine if you've got a child who is having those obsessive thoughts and it's impacting their regulations, so they're
It is.
dysregulated in the classroom,
Yeah,
therefore they're not getting their work done, is how it's perceived. Actually, it could be the other way around. They're struggling with their work. And actually, where we're focusing on the behaviour that is presented, the actions the child takes, and then dismiss that inability in math or something because then they're playing up, then we're not looking at the whole picture.
absolutely. And the other part of this that I think we don't kind of have enough training or emphasis on is, well, the psychological changes that a child undergoes when they've been able to function in one way, perhaps perfectly managing in the classroom, and suddenly they may lose or temporarily lose some of these skills, but they're aware, very in most cases, that they are functioning at a different level, but they don't have an explanation for why that is. So often those needs haven't been identified, just as you pointed out, or interpreted in the right way, but also the child or young person themselves doesn't understand, alongside their family and often professionals, what is happening to them. And if we kind of step into their shoes for a minute, that must be really, really frightening. If you were able to write competently and well at length, and then you've lost that ability and you don't know why, and it's being misinterpreted, why you've lost that ability.
Yes, and you're frustrated, but you're probably unable. Again, for younger children, it's that ability to express how that makes you feel, because you've never experienced this before where you could do something, but now you can't.
Exactly. And also what you might then need. So the understanding and perspective on that is obviously going to shape the accommodations that we would then build in around a child to provide that scaffolding and those supports in the classroom.
So you mentioned there is a set of criteria.
Yeah,
That's probably a long list of criteria and
it is.
quite wordy and complicated. But can you give a generalised kind of representation of the things it covers?
Yes. So, firstly, for the full diagnostic criteria, please go to the charity website and you'll find it listed. But some of the key symptoms are obsessive compulsive behaviour, tics, restricted eating. So those are three of the key kind of main symptoms across both of those conditions. And then there's a whole scope of others, including sensory needs. You can have sleeping difficulties. You can have cognitive changes, anxiety, and many more that are not all inside my head.
And it's going to be they weren't present before,
Exactly.
or they were different before. Because as you said, a neurodivergent person
Of
can still
course.
get PANS and PANDAS. So they already might be having difficulties in these areas,
Of course.
but there is a change.
Exactly. We always say you're looking for multiple unexplained changes. And of course, it's not just children without neurodivergence or neurodivergence, but any child could develop this as a medical condition, just the same as any other medical condition.
It's like when they change a character in the mum in Fresh Prince of Bel-Air, for those who ever watched it. Change the mum, change the actress, carried on as perfectly normal. It's like in EastEnders when the character comes back and you're like, you're not that character. In theory, they are, but they are just different, and you know it's different.
And the changes are uniformly hugely distressing, across the board of those symptoms.
It's really interesting because it is really hard. It's one of those things, everyone loves a nice 5-step list to know if your child's got PANS or PANDAS. Not sure, they'll be different. Different in what way? Could be lots of different ways, might be. And you've got that criteria, But as you said, going again, it's reiterating, you have to know the child before.
Yes, and if you didn't know the child before and the parents and carers are saying, look, my child is changed, it's really helpful to go back, take a step back, looking at the developmental history or checking back with a previous teacher or setting.
I was about to say, yeah, if you're in a primary school or if you can go back to that previous teacher and can you just come and sit with this child and spend some time with them? That is probably for a school the crucial bit of information, because they will have that where they are now, where they should be able to do this, and they'll meet them and just be going, no, there's something, it's not they're just struggling academically. They'll recognise the changes.
Absolutely. And we know that this can be, it can be problematic if your child develops this, when you're transitioning between settings, or is in a setting now where no professional knew the child before. And that is, it sounds really simple, but actually it will be really helpful to the families if we can let's just look back, let's just check back. Like you said, it's not just academic, but some of those assessments and data points might be useful information to compare.
So, again, when we talked about maybe having chicken pox and strep and things like that,
Yeah.
some children, it hardly affects them. They have the rash and it's hardly affecting them. And others, it impacts them hugely. So, again, just looking for, is it a case of it's going to be, and you'll probably go, it's a variety. But is it a case of it's those who are impacted more as they're coming kind of back to their normal? There's a change. Is there an indication of, is it the longer the illness, the more it's going to impact, the more likelihood? Is it kind of, when does it change? Is it during? Is it after? It's just lots of questions.
Those are all good questions. Some of them are straying a bit into the clinical area. Okay, so I'm just talking as me, and so not as a clinician. So my understanding is no, it's not particularly related to the severity of the infection. That's my understanding. So it could be quite a mild infection. So that's a key thing. And then I think you asked about how long after the infection. It's variable. So some families say it's within like 24 hours. So it's really quick. But then others say that it's longer. But the diagnostic criteria do stipulate an acute onset. So it needs to be fairly soon following the infection to fit with the current diagnostic criteria and where we're sitting at the moment.
Because to me, I suppose it's like sometimes you'll say you've had the flu.
Yeah.
You've had a cold, you've had a chest infection, and then you really have the flu, and you're like, oh, now I've had the flu, and it takes me a while to recover. Or you and your partner will both get the same sort of cold, and one of you's up after 6 hours, and the other's in bed for 3 days.
Yeah.
And it's how, in reality, if you're looking for those changes, it depends how long it takes them back to get to their normal self for you to notice there is a change. Lots of us are quite grumpy when we're tired. Lots of us can be grumpy if people are doing, because we like being self-sufficient. So you almost got to get to that normal to go, hang on, this isn't their normal, this is different. And I suppose you'll give them time to, they'll be themselves, they're just still unwell or they're still not feeling great. So you've got that thought in your head as well, I'm guessing.
I think it's really difficult to convey that you would definitely know. So you would definitely, as a parent and carer, be able to recognise that something is seriously amiss with my child and some of the specific things that they're doing that they just weren't doing before. So when we talk about separation anxiety, we might think, well, yeah, a child gets an infection. They naturally regress a little bit when they're poorly children, don't they? They need more care. They need their family around them a bit more. And you do a bit more for them, don't you? And then they kind of get better and you kind of take a step back. The level of severity of this separation anxiety might mean that a child literally is following their parent carer around the house all of the time, needs physical contact and to be next to them, is terrified that something bad will happen to their parent and carer if they leave the house, can't shower without their parent carer, can't sleep without being next to and physically touching their kind of parent carer. That's the level of intensity that can be one of the symptoms. So it goes well beyond the typical, my child just needs me a bit more now because they're not well.
Yeah. Okay. Yeah. So it's not just a case of you're just, like a day or two of sitting with them, and then it's actually I cannot leave you at all.
I can't leave
And
you, and I'm worried incessantly about you when you're not with me. And then, of course, when you are kind to go to school, the level of intensity and distress caused by that separation, at the school gates, is huge, and also often continues throughout the day, so it doesn't really settle. And the child will be thinking something really bad is happening to my mum or dad or my carer. And sometimes children think they're responsible for something bad happening to them. And of course, that can easily be misinterpreted as not a part of a medical condition. But what I think you're going to notice is what a difference. So it might be a child before that skipped happily through the school gates into the classroom and now literally can't leave mum or dad.
it won't go away in a day or two.
And
It's not like,
it
oh, it's
doesn't
just
go
their first day
away.
back.
No, and it comes with lots of other symptoms. That's the thing. You don't get separation anxiety in isolation. You get it alongside lots of these other symptoms at the same time. So the child's trying to manage all of those symptoms in the classroom.
Yeah. So it's not a case you are literally going to be looking at your child, going, what's going on? You'll literally be going, and again, you could be literally thinking you're just playing up. You're just doing this, and you've got to. It must take some parents, for them to go, this isn't just a change because they're needy or they're trying to get not to go into school because they've liked being at home. You're literally going, okay, you're really full on here, and you need to. And it probably takes them to sit there and go, hang on, something's changed, and for the parents to understand that probably takes a while, and then they've got to convince everyone else.
Yeah, it's about kind of, and sometimes what's seen at home is different, like in other conditions, it's different to what might be seen in the school environment. And also, we know that many of the symptoms of PANS and PANDAS are also internal. So, obviously, these kind of obsessive thoughts or these mental kind of rituals, the levels of anxiety, the thoughts that children are having. We know that some children and young people hallucinate as part of these conditions. So, although it's not part of the diagnostic criteria, there's a lot of families reporting these types of symptoms. So, some of these symptoms are not typical, they're very unusual, and they all come together at a similar time. So they have this kind of cumulative or overlapping impact on a child. And you'll often find that schoolwork will dramatically kind of change and decline in the amount and quality that a child can manage. And as we touched on earlier, that would be very easy to kind of misinterpret the root cause of that decline.
And I was just thinking where you kind of, it's different at home, at school, and which makes me think of masking.
Yeah.
I think when I think of masking is lots of people do it
Yeah.
sometimes through it's better for them to mask, whatever. I'm not going to get into that, but it's something you kind of learn. Oh, I'm not quite fitting in. If I do this, I fit in better, and it makes life easier. So it's a learnt behaviour, and you'll perfect it. So with PANS and PANDAS, where it is like you're ill and like you've never learnt to mask, but also I'm thinking right there and then from all the stuff you've talked about, you're reacting yourself to a change. It's not you consciously needing your mum; it's subconsciously needing mum. That not to be a part. So it's not a case of you can mask. So I'm guessing you are probably more likely to see it at home and at school. you're probably more likely to see different behaviours than previous at school. Not they'll drop into the same, and it's just because they haven't maybe learnt to mask unless they were already neurodivergent, which again throws. This is complicated.
I think the masking is complicated, and a lot of our families ask us about it, and a lot of professionals say, "Well, how can they mask if it's a medical condition?" And it's a good question. And I think what we have to take on board is that masking doesn't mean the symptoms aren't there. It's about how much you are choosing to share about those symptoms and how much they are shaping what you are doing in the school environment. So, children who've got this are usually really aware of the change in their own functioning. They often tell us that they feel humiliated because they can't do the same level of work that they were doing before. And they, of course, will then adapt strategies to try and appear as they always have been within that environment. And although we don't have any research around that, and this is just my thoughts on it, that to me makes perfect sense. And if you are sitting with obsessive compulsive thoughts all day in school, while some of them are quite horrific, I would need to have a very, very close relationship with someone to be able to share the details of that while I'm sitting in the classroom. And particularly if before I had all of this, I didn't need a teaching assistant, or I didn't need additional support. And I sat with that group over there and did that work. And now I'm outside the classroom on a table, with my support assistant, and I can't do what, he or she is trying to help me to do anymore. And I think we really need to get inside our children and young people's head to ask ourselves, how would that feel? And what can we do to provide that support? And if it was me and I was then going home, I would then also go home and share, well, I've had all these thoughts today, or I thought someone was following me, or this happened, or that, and I think it is entirely understandable.
And I think it is, as you said, they're going to learn to mask maybe quite quickly. But in my head initially is like, okay, this is not right. I've got all my questions wrong. I normally get 80% or whatever. And then you're going, well, I won't let that happen again. So it's almost like there's that first unmaskedness, and they're going, I've got to cover that up. I've got to hide this because I won't be sat with my friends. I'll be sat with not my. Yeah. So that's a huge psychological load on that child.
It's massive.
Because again, and we're thinking again, a lot of the time when we're thinking education, we're thinking academic performance, we're thinking this, we're thinking that. But this is going to completely change, or can completely change, friendships, their self-worth, their confidence, as well as all the kind of, on top of all the things that you said may change, that they're managing, actually their personality and everything about them is going to change. And they're probably also longing for, can we go back? Can we go back to when I was happy? Can we go? You've probably got all those thoughts as well, that actually, as you said, they're aware of that change. They're aware of what it used to be and how they manage that themselves.
And that's right. And that kind of comes down, I think, to us understanding and being aware that these conditions do exist. Because, of course, the sooner that we can spot these needs in the classroom, and we know that, support in school is needs led and not diagnoses led. So, as soon as we can spot this pattern of, sudden onset of changes that goes in this kind of, we call it relapsing and remitting. So, a child gets an infection, then they might have something that we would then call a flare. So they might have this, severe scope of neuropsychiatric symptoms, and then typically will then over time get better. And the time frame for that is massively variable. Again, it can go from days to weeks to months to even sadly years for some children. And then they'll get another infection and the whole cycle will then start again. And it's about, if it's this, us understanding that so that we can get those needs understood psychologically and practically at a much earlier stage, so that the child doesn't feel they're free falling with all of these symptoms with nobody to catch them.
So again, you said something there and it just made me think, so are PANS and PANDAS lifelong conditions, or is it a case of they are lifelong but you learn how to, what are they from what you know so far?
Again, from what we know so far and from my understanding, children can and do get better. Some children have many cycles of PANS and PANDAS, and for some, those cycles continue on into adulthood. We don't have statistics at the moment, so we don't know how many children and young people in the UK are affected. We've got about 7,500 families, I think, on the charity Facebook group. So we're not saying they've all got PANS or PANDAS, but what these families are reporting are this sudden onset of these types of symptoms. We know that in some cases it can continue into adulthood, but we just don't have the research and further information to say with any certainty what the longer term trajectories look like and how many children are affected.
And I suppose is until you've got a lot more time and research, it's whether or not is it a case of children, they learn how to mask better, which is why it kind of goes away in air quotes. And then when they're, you can see many cycles, is it a case of it comes back the same each time? I've got so many questions I could ask.
Yeah, no, and it is. And the more questions you're asking me, the more I'm realising how difficult it is to answer you, like genuinely. So in terms of cycles, do the same symptoms come back? Again, some children get very similar symptoms per flare, but they can be different levels of severity. Some children get some symptoms the same as some new, and for others, flares bring different types of symptoms. So there's not the same clear trajectory per child. It covers a wide scope of severity.
Wow.
And the fact that the UK are working on clinical guidelines, that will be then to provide effective medical treatments to reduce this, neuroinflammatory response to the infection. And they should be out in autumn in 2026. So what we would like to see is a greater awareness of these conditions, and there are plans afoot now to gather that incidence data, because we need to know what is the scale and scope, how many children have we got living with these conditions. And I think from an education point of view, we need to just have this one in our toolbox to be aware of it if we notice a child with these kind of multiple unexplained changes, because there's so much that we can do to then put in that kind of early and very agile support, because you've got to be quick. You can't, you can't sort of say, well, we'll review this over 4 cycles of assess, plan, do and review. You need to quickly be putting in accommodations for those needs, because things can change very quickly for these children. And also, if we understand what it is, we can also support children, but when they're getting better, support them to get better, and also respect their baseline. So where were they before they started? And to remain aspirational, that's where we want to kind of get back to, and that's what we want to support.
I'm guessing for those children who have those flare-ups, they probably get better at managing and monitoring and knowing themselves, and can probably recognise, I'm in this zone.
I think so. Yeah.
And so partly they'll be able to self-manage, partly they'll be able to self-advocate as they get older. But it is kind of, and it's a bit like if you have my colleague with an autoimmune condition,
Yeah.
and he will be fine, and then he'll have a flare-up. And during that flare-up, someone with that might not be that mobile. There's no point in doing an APDR cycle over a year and a bit to work out, well, there's this. Actually, while they're they're struggling with that mobility, support them in that moment. And as that flare up decreases, they won't need that support. And in theory, it's the same with PANS and PANDAS.
So we know that some children go back to baseline. So we have this kind of cycle and they go back to where they were. But obviously you've still got the psychological impact. Even if your skills go back to baseline, you've got the psychological impact of living with an unpredictable condition from whom you may well not have a diagnosis and not be getting any treatment. But we know that for other children, not all of their skills do go back to baseline once that flare up has gone. And it's about us understanding that it's important to be tracking that and checking that, and then preferably sharing that information with those clinical teams to inform the treatment that that child is having. Because we know that for some of the cohort, their baseline is being lost over time. Because nobody has ever seen them present any differently, often apart from their families. And some of the learning difficulties that we might see in PANS and PANDAS can also be transient. So they might have an assessment by somebody and, it shows X, Y, and Z. And the person assessing them might think, okay, those are permanent, those are permanent things that this child needs particular help with. But actually, they could be transient. And we need to understand that, because that has implications for settings where you put children, EHCPs, because a lot of our children with PANS and PANDAS go on to require education, health and care plans, including children with no prior evidence of any needs.
There are just so many. Literally, I'm thinking like going into like doing GCSEs. If you have a flare up just before your GCSEs, that's kind of be your GCSEs out.
And
But
you
if
might,
it was 3 months later, you're ready to take your GCSEs.
yeah, and it might not be your normal way of working. So if you didn't need those accommodations all of the time, then it might be quite challenging to get those exam accommodations that you needed, because the needs might not have been recognised, or you might not be your typical way of working, because your needs and what you need to support those needs are likely to fluctuate, and fluctuate a lot in some cases.
And also PANS, I believe it's PANS, can go into adulthood.
Yeah, so the P for paediatric is misleading. It's not only that it can go into adulthood, it can affect adults as well. And PANDAS is a paediatric diagnosis. So I think peak onset's between about 3 and puberty. But what we know is from families report that symptoms don't always resolve at 16, 18 or beyond in all cases.
I was just literally thinking, if you're trying to get that job and you've got to declare you get a medical form and you're going to write down PANS and you're looking for that reasonable adjustment, there's going to be very limited information out there. And also, because it's so specific to a person and it's so time-based, the guidance will be really vague.
Yeah, and I know that part of the local authority guidance is looking at the area of transitioning, because we know it's a challenge, don't we? Those transition phases, and it's about applying effective principles for other conditions that also have flare-ups within the context of understanding this particular condition and how they can present and what that might mean for an individual going forward.
No, I always love podcasting because I learn so much, and I always like to leave a podcast going, right, so I've got my 5-point list. I know exactly, I've learned so much. And I have learned so much, but it's really impossible to write down what I've learned. I could write down every single question and then go, it depends, it depends, it depends, but it's all of those questions together is what PANS and PANDAS is. One question on its own isn't PANS. It's the changes, it's the time frame, it's how long it lasts. There are so many bits to it. So it's probably a nightmare having all your documents and sharing that information. You can't share it in a single page item. You always have to explain. There's always more information needed to help people fully understand it.
I always think, because we deliver training, and one of the teacher training, one of the things we talk about are kind of spotting the unusual characteristics. So I think what helps is, because you're right, it's a bit woolly and it's complex. And I think what helps is having the key principles that override these conditions, such as acute onset, diagnostic criteria, these are medical, uncertain longer term trajectories. And uncertain doesn't mean for everybody it's long term. Uncertain means it's very variable. And it's about understanding those unusual characteristics. And then sitting within that framework is the individual with their own particular symptom spectrum, history of flares, age of onset will obviously affect you differently if you got this at 4 than if you've got this at 15, because you're at a different stage in your development. And I think it's about that. And in terms of sharing information, it's about those salient points, isn't it? It's about the key points that school need to kind of understand when providing support for something that fluctuates and changes. And we often talk about it in cycles because that helps to provide, again, a framework around some of the woolliness. So like when a child is flaring, they will have reduced cognitive capacity and load. So it's about compensating for any of those impaired skills, keeping them safe, highlighting relationships. They may be too unwell to be in school. Then during recovery, it's about thinking about raising the expectations a little bit about what they can achieve, but in line with their social, emotional, and mental health needs.
Yeah.
And then while they're feeling better, the support should be around, well, let's have a check. Where are they sitting now? Have those impaired skills gone back to baseline? And do we need to continue those accommodations kind of longer term? It's about having the long game about a child's engagement with their education, I think, in your mind, and thinking about the experiences they're creating. Because this, sitting in a classroom doesn't equate the ability to learn. This.
So basically, hopefully, what this whole episode has done is, for those who may have heard of it, it's given them much more concrete information about it. For those who've never heard of PANS and PANDAS, it's introduced you to this area. It's introduced you to, and you may have already seen it, but may have not been able to explain what was going on. But it is, hopefully, it's one of those things which you'll keep in your toolkit. That's what you want, isn't it? It's that awareness of it. So when someone comes back from a 2 weeks off ill and is a completely different child, it's not they've been mollycoddled or spoilt for 2 weeks. Actually, they're big changes. This could be PANS or PANDAS. And I think that's the big thing, is that awareness that actually there is support needed. It's not a blame. It's not tell them off. It's that awareness to maybe just ask a few more questions and be going, okay, this could be PANS. That's what we're really hoping for.
I think you're right. And I think in terms of schools, what families have said is really helpful is if families document the changes and if school can document those changes. But as we talked about originally, giving equal weighting to all of the changes so that inadvertently a skewed picture isn't presented. And then you can take that along to the GP and then see whether any further medical investigation might be needed.
And you missed out. Take it to the GP, probably educate them.
So there's a leaflet. There's a leaflet on the charity website for GPs, and there's also a CAMS leaflet. There's also a medical page with lots of information generally for medical professionals. But you're right in that at the moment, those levels of awareness are low. And there's also a training module actually online, free for any health professionals to access, for anybody who might want to know a little bit more about diagnosing and treating these conditions. So there is information out there, but it's limited.
It is. And it's always, as an organisation, you're researching kind of the impact. You're researching the why. So you're doing all this research, and it is going to take time. As with many things, it's the more research, the more we understand, the better. But even probably over time, we'll probably be able to never pinpoint something because it's just so almost like specific coincidences have to happen. But the more information we have, the more knowledge as many people have, the better. And as you have just mentioned about all the information available, I'm going to wrap it up. And I'm going to thank you because I really enjoyed the conversation. I always love concrete answers, but I completely understand. Now I know more about pandas and PANS, why there is no such thing as a concrete answer. And for all the things Tina's mentioned, there are loads of links in the show notes to resources on the PANS and PANDAS websites. There's resources for education professionals, there's training, local authority information and updates. So I'll put links to all of them, their website, their Twitter, their Facebook. You can email. So loads of information. And as always, you'll find those the links in the show notes, which is wherever you listen to the podcast or on the Zencast website. And if you want to get in touch, let us know your thoughts, suggest topics or anything else, please send us a message through one of our social media accounts or send an email to hello@thezencast.com. The Zencast is created by us here at B Squared. And do you know about our AI features in our assessment software? Teachers can use our AI to help write their reports or summarise progress, and teachers choose the key achievements and the key next steps for each pupil. So it is very personalised. It's just that the AI takes the hard work away, turning what you want to focus on and creating your lovely paragraphs of text. And it can also translate into over 40 different languages, helping to engage parents where English is not their first language. Visit the B Square website or click on the meeting link in the show notes to book a meeting with me to take you through our assessment software and all of its AI features. But finally, thank you for listening, and we'll be back next week with another episode of the Zencast. It's goodbye from me.
And it's goodbye from me. Thank you very much for having me.
You are welcome. Bye, everyone.